Well, welcome everybody. We are excited to have you join us this morning for our Survive and Thrive virtual webinar. I am excited to have Sydney Townsend and Stephanie Broussard talk on virtual care. I'm gonna, first of all, something happened today that hasn't happened in like over 2 years, 3 years. We are actually all together in person, and Sydney is actually in a room right across the hall. So it's so nice to see these ladies face to face, and I'm excited for what they're going to share with you this morning. For those who don't know, the Texas Oncology Foundation exists to support patients in their communities where they live, work, and receive treatment. We have a number of programs. Please visit our website, texasoncologyfoundation.org, to learn more. I just want to jump right in, but let me go over some housekeeping items before I hand this off to our panelists. So just a reminder, only you can see us and hear us. We do not see you and we do not hear you. If you want to ask a question throughout, please do so. We would love to field those questions at the end of the presentation, so just communicate that via chat. If you have technical difficulties, the best solution is typically to exit and then rejoin the webinar. And if you are experiencing audio issues, it's always best maybe to just dial in to listen from a landline or your cell phone. Again, we will take some questions at the end. If there are some, please put them in the chat and we will answer those. And just another reminder, this webinar is recorded, so it will be archived online so you can watch it again if you'd like, or share it with any friends. So before I keep talking, I need to just stop and hand it over to these two wonderful ladies who are going to talk to us on virtual care. So who is starting this morning?
I can get started. Yeah, but Stephanie, do you want to introduce yourself, and then I'll introduce myself and get us going?
Perfect. I'm Stephanie Broussard. I am the Director of Palliative Care and Social Work at Texas Oncology. Nice to be with you guys again.
And this is my first time with this group. So I'm Sydney Townsend. I'm the Executive Director of Digital Health at Texas Oncology, and really excited to talk to you today about virtual care and the role it plays in your cancer care journey. I did want to tell you that I myself am a cancer patient at Texas Oncology. And before I joined Texas Oncology, I was working in virtual care like back before most people had done it. I spent a lot of time trying to convince doctors that this was a safe way to deliver care and convince patients that it was a safe way to receive care. And then the pandemic happened and we all jumped in the deep end of virtual care. So now it is just part of the normal, way that we receive care, but there's a lot of different aspects to it. And so I can really relate with you on how you might use this in your cancer care journey, because I certainly did. And I was probably the most annoying cancer patient because I kept asking for these advanced virtual care opportunities, even when they weren't so widely available. So really excited to share this all with you today. So what is virtual care would be the first question. And if you don't know exactly what it means, you are not alone. There is not like a Webster dictionary definition of virtual care yet, but it is generally a broad term that encompasses all forms of remote care delivery. And underneath it is kind of the bubble of telemedicine and telehealth, and I'll explain those two things. Then we'll broaden out to virtual care, which is more, includes telemedicine and telehealth, but also includes more. And then above that is the umbrella of digital health. And we won't talk too much about digital health today, but we'll focus on virtual care. So starting with telemedicine and telehealth. Here's a couple more confusing words. You might have heard these interchangeably, right? And just for added layers of fun, it depends on who you're asking. The federal government has one definition. The Texas government has another definition. Your friend down the street has a different definition. So I'm going to explain it in some of the more narrow ways to think about this, mostly how Texas law defines it, but I'll kind of explain the difference. So telemedicine, this is usually when you use a video visit with audio and visual connection between you and your physician or advanced practice provider. An advanced practice provider is like a nurse practitioner or a physician's assistant. So it's called telemedicine because they're delivering that medical care with a medical license. It should be the same cost as in-person care. It can be used to replace most kinds of in-person visits. If you need a hands-on exam it's not the best, right? There are some crazy workarounds out there, but somebody really needs to touch and feel something, it's best to be in person. And really your physician will determine when it's appropriate in your journey to have this telemedicine care, and if they offer it and for what. I know at Texas Oncology, it's offered for the full spectrum. So from all the way to new patient visits, through treatment, and then all the way into survivorship, there's various virtual care opportunities, but that's really up to you and your provider. So it should be your choice too. If they say, I want to see you virtually, and you say, no, I'd really rather be in person, that's okay too. So that's telemedicine. And then if we expand a little, telehealth includes video visits between you and another member of the care team. So maybe not the doctor or advanced practice provider, but your nurse, your social worker, your counselor, dietitian, spiritual care, physical therapy, any of those things are telehealth. Some people also lump in the doctors, but just for our clarity, we'll separate them today. So you've got telemedicine with your doctor and APP, and then telehealth with other members of your care team. And, again, during the pandemic, we've really seen this expand. I think most of us would have thought, well, physical therapy, like I have to be in the physical therapy center to do that. But tons of physical therapists are now offering physical therapy remotely via telehealth. And it's fantastic because you can actually practice it at home where you will be doing most of your practice for your exercises. So, and same for dietitians. I love it for dietitians because they can actually, you can take your little camera to your pantry and your refrigerator and say, here's the foods I eat. Is this good or bad? Instead of them showing you things in their office. So some really big benefits there. Stephanie, do you want to talk about how that can work for counseling, spiritual care, things like social work?
Absolutely. So one of the things that's really impactful with telehealth and counseling, and I think really even telemedicine as well, is that, when we're able to provide services in the home, there's a little bit of a power differential shift. So for example, when you walk into the clinic, sometimes you're walking to a place that maybe doesn't feel as comfortable. Sometimes it can feel pretty sterile. But when you're receiving these services at home, you have the comfort of your own environment. And so services like social worker, counseling, or spiritual care, where we're really going to discuss maybe some difficult issues that may be taxing, or maybe you want to bring other people in. Telehealth really has the ability to engage and expand our net where we maybe have some confines in the clinic. And so, for example, when you're with your social worker, especially depending on the scope, if we're doing assessments, we can do those via telehealth. We do use, depending on where you are, they may use different methods. But also, even our insurances, most of the major insurances right now also include the coverage for behavioral health services via telehealth. So that would be a psychiatrist, that would be a counselor, psychologist, an LCSW, or an LPC, or an LMFT, if your insurance covers those services. And so you could be right at home with someone on your camera, discussing what you need and having that dynamic as well in a therapeutic setting that would still be really impactful.
Yeah, it's such a great way, I think, to get care. And again, it has to be something you're up for. But what you would need to be able to engage in either telemedicine or telehealth is, a smartphone with a camera, or a computer with a camera, and, speakers and microphone. If you're using your computer, they have to be able to hear you, and you have to be able to hear them, but all of that's built into your phone. So you need a device that can do that. And then you also need connectivity, good connectivity. So either internet or cell connectivity that's stable. I would not recommend, for a number of reasons, like doing this appointment from your car. Okay, certainly not if you're driving, but if somebody else is driving, your connectivity is not going to be great. You're going to bounce around. So, you want to be somewhere stable with good connectivity, probably plugged into a power source. Sometimes these applications can really drain your battery. And then private, right? Like, this is probably not good to do at Target. Like, you're going to be talking about your health information, and that should be a private opportunity for you.
Yeah, and I think, Sydney, privacy is one sometimes that, because of our portability now with our cell phones, sometimes people forget really the importance of having privacy when we're engaging in these types of appointments. But we really want you to be able to get everything out the appointments. And so whether it's with us or anyone else, and you can't do that if you don't have the freedom to speak freely. And so privacy is something that's often overlooked. So even if you're at home and multiple people are there and you don't have the freedom to speak, it's still not as beneficial. So make sure you also have privacy.
Absolutely. And that's, really how it works. And again, so deciding with you and your provider, like, hey, could my next visit be virtual? I'd like to do that. And discussing the benefits there and your setup and any questions that you have, maybe even practicing getting on the platform that they use, if that's an opportunity. Just getting ready for the visit is great. And then should be super easy. You don't have to drive if you're having, transportation issues. If you're working, you don't have to take as much time off work because you're not driving to park and do all those things. So really great opportunity, I think. I love it. My oncologist has not seen me in person in years. Eventually, I think she's going to make me come in. Okay, let's talk about some other virtual care opportunities. So this is a long, fancy name, electronic patient-reported outcomes. It's a long name, sounds pretty boring, but it's actually really cool. So these are electronic surveys that you fill out. I've included a screenshot of one that we use at Texas Oncology, but they could look a lot of different ways. And you report on how you're doing with your health. And so it'll typically ask you about your symptoms, and you rate them usually on a 1 to 5 scale, like what's going on with you, how are you feeling, how good, how bad, did you take your medicine, things like that. And the really great thing here is that it provides you insights about your own care. Like maybe when you fill this out, you notice that, oh wow, on the 3rd day after my chemo treatment, every 3rd day after my chemo treatment, I feel really nauseous. Is there something I could be doing on day 2 to help me feel better? You can get ahead of that, or like, oh, I know I'm not going to feel great. I better plan to have some smoothies in the fridge, or whatever your go-to, comfort item is. It can help you get ahead of that. It can help you surface things to your care team and say, hey, I've really noticed this. Can you help me with it? And then also they're monitoring these results. So if you report like, man, my pain is at a 5, you should expect to hear from somebody like very quickly. This should be a way for them to know what's going on with you in real time. And then also to look at those trends over time. Like, I see that on the 3rd week after your chemo, you're often in pain or nauseous or have diarrhea, whatever the symptom is, they can start to monitor that trend too and help you with ways to manage. So very cool tool, and it should be something very easy that you just fill out, and your care team will tell you how often. It might be once a week, it might be once a day, just depending on what's going on, sometimes twice a day. They'll tell you how frequently you fill these out, but should be pretty easy and a great way to really empower you in your care and tell your care team more. Is there anything you want to add, Stephanie?
Yeah, and I think something else that's really important when we think about electronic patient-reported outcomes is that often we also are trying to figure out ways across the board, and when I say across the board, I mean in healthcare in general, how to expand that to our practical needs and our emotional distress as well. And so there may be some surveys that ask questions about food insufficiency, or do you have trouble getting to the doctor, or any practical barriers? Are you having trouble with housing or financial issues as we look down the road in regards to social determinants of health? It also may include questions about your emotional status, about how you're feeling. And sometimes we don't think about those things as our doctors wanting to know, but that's how we can best care for you, is being able to see the whole picture. And so it's a really great way to get more information and being able to report those things outside of an appointment.
That's right. I know I found doing these in my own treatment that I've noticed a pattern. There was a certain medication I was taking that affected my emotional health, right? And I didn't realize that until I had this documentation, and over time, I'm like, oh, there we go. So it really can help you, key in on a lot of different things.
Absolutely.
All right. Let's talk about something else. Okay, so this remote patient monitoring, this is next level up from the electronic patient reported outcomes. So this usually has the electronic patient reported outcomes. You would also be doing those maybe more frequently, and then electronic devices that monitor your vitals. So depending on your condition, this could be something like a scale, a thermometer, a blood pressure cuff, if blood sugar is an issue, a glucometer, just whatever your care team would need to monitor consistently, you would get a device for that. And this would prompt you to do your survey and take your readings, usually once or twice a day at least, to really stay on top of it. And so this is like remote eyes on practically for you, for the care team, so that they can see what's happening with you and potentially get ahead of any issues. I think there's an example, some cancers cause like congestive heart failure symptoms, like where you're retaining a lot of water. And if you are doing these measurements and this weight as frequently as you should be, your care team can say, oh, goodness, she jumped up 5 pounds overnight. I think there's an issue. I'm going to call as the nurse, get ahead of it, talk to the patient, see if maybe we need to bring them in today, you know, to get care in the clinic, and really stay ahead of these things. It's exciting technology. I definitely requested it when I was in treatment. They did not yet have it in cancer. But, you know, for me, it felt like a really great security blanket that your care team would know it was happening all the time.
Yeah. Even been some advances in emotional status monitoring with tools like biofeedback, you know, and devices that you connect to you to see when people are trying to figure out their emotional stressors. How's your body responding when you're in certain situations, so that we could better help address them. So even in therapeutic components, those kind of things are being offered as well.
Absolutely. And again, voluntary program, if this is something that seems like a little too closely monitoring you, it's not something that you would have to do, but it could be a tool that's available to you, and you'd want to talk to your care team about it. Okay, the patient portal. Now, this should be available to everyone and every doctor they go to. We are here in 2022. There should be a patient portal. And patient portals are great for a lot of things. Different portals have different you know, things in them, but at the core level, you should be able to access your medical records. So you should be able to see your like lab results and vitals. Often your visit notes would be contained in there. You should be able to communicate with your care team via secure messaging back and forth. A lot of portals have information on your diagnosis. So some kind of education material that you can learn more about, you know, either your diagnosis or your particular treatment, the medications you're taking. Sometimes there's nutritional information to supplement, you know, all kinds of things. And then you should also be able to see information on your upcoming appointments. So if you're wondering, like, when did I schedule that next thing? Or was that at 9 a.m. or 10 a.m.? That should be in your portal. So you can go check there and not have to do a phone call, because I know sometimes we just don't feel like calling. It's nice just to be able to get the information on demand when we want it, at, you know, whether that's at 10 a.m. or 10 p.m. It is there available for you. Anything on this, Stephanie?
No, you covered it.
All right, use your portal, sign up. I know there's a lot of them and you have to remember the logins and do all the things, but it's a really great tool. So highly recommend that you sign up for your care providers portal and use it.
I do have something to say.
Okay.
One of the things about portals that I think is really beneficial, making sure that not only you have access, but if there's someone that is part of your care team or support system at home, making sure that they also know how to access the portal if they needed to. So is there information that you would want them to have access to if something were to happen, making sure that they would know how to do that so they can provide, for example, EMS, a list of your medications, that kind of thing, if you don't have them stored somewhere else.
And some portals even allow you to like partition off, you know, I want to grant Stephanie access to my portal, but I only want her to see my medication list, or I only want her to see my upcoming appointments because she's going to drive me there, but she doesn't really need to see my medication list, right? So there are, not all portals, but some portals do allow you to grant various levels of access to other people. So that's also something to ask about. All right, nurse triage. This is a really, really great virtual care tool and has been going on since we came up with the word virtual care. So this is something I'm sure that you have used in your life and certainly in your journey as a cancer patient, whether you knew it or not. So these are nurses that answer your questions and concerns when you call in. So if you are not feeling well and you call the office and say, I need to talk to someone, I'm not feeling well, usually it's the nurse that calls you back, right? Or they transfer you to the nurse's line or voicemail box, or they take a message so the nurse can call you back. And that's usually the first person you talk to. And they are so knowledgeable, right? Our nurses, man, they just know so much. And their job is to first understand more what's going on with you, really get a full picture of what's happening. And then they're going to have some information that they can give you. Like they might have what they call standing orders, that they know that if you're having nausea, here are some things that they can tell you to do at home, and here's some medications that they know the doctor will prescribe, right? So they might have some standing orders that they know they can do. and pathways that they'll use to follow, like, oh, if this particular symptom's happening, here's all the questions I should ask, here's some possible things that I can recommend to help. But if it's something beyond that, beyond what they can help you through, then their job is to be the liaison with your doctor or your advanced practice provider. So they'll take that information to the doctor. They'll say, hey, here's what's going on with Sydney. You know, she's concerned about this. She'd like to know what to do. We talked about these home care opportunities, but that's not really managing it. What else would you like to do for Sydney? And then they'll get those orders. They'll call you back. They'll call in any necessary medications or set up any tests or appointments. Sometimes the answer is just, oh, that sounds bad. We need to see you today, right? And they can help facilitate that and make sure that you get that appointment when you need it. So really great team, and they're going to want to help you stay out of the hospital. And I know, as a fellow cancer patient, the last place I want to be is the hospital. Oh man, like, do not go. No, thank you. Keep me out. So the more that your care team can do with you, the better. So call, talk to those triage nurses when you have something going on.
Remember, there isn't anything that's too small. Of course, you know, sometimes we don't want to bother. We think, well, I can just wait. We rather, like in any situation, always err on the side of caution and use that triage when you have access to it, because it's better to have that information than to wait and it be something else.
Absolutely. They want to help. They are there to help.
Absolutely.
So call. So, nurse triage, fantastic tool. Online support groups. Stephanie, you want to talk about that one?
Yeah, so one of the things that I think is really important when it comes to just cancer care in particular, is community. I think having the ability to share time and space with people who get it, I think there's so much value there. And for some of us, there may not be a support system that you already have in your community to lean on. So it's really important to be able to foster community. And I think online support groups do that. So they establish community for us. They can also help us reduce stress, depression, anxiety, or fatigue. And the way they do that is because we have this space to validate our emotions. We have people to facilitate these conversations and help us process. Whereas without access, sometimes we'll harbor some of those feelings and thoughts, and it can create all these things and just exacerbate other symptoms or feelings of distress. And so having a community where someone can say, you know what, that was my experience too, or I hear you, and thank you for sharing that, can really make the difference. Those open and honest conversations about experiences and feelings are really important. One of the things, even in therapeutic settings, when I'm doing one-on-one counseling with individuals, that I hear is that sometimes people in our families don't get it. And so having someone who understands, where you can be really honest about your fears and your worries in community, not just one-on-one with another person, can be really helpful. And like I said, ultimately, those things, every layer reduces that distress that you could experience. And then also, support groups aren't just to hear other people's problems and you get your problems off your chest. It's also a learning educational environment. And so you can learn skills to cope with challenges. Sometimes they provide like psychoeducation or disease education. And we can also learn about health and economic or even social resources. They provide education on the experience depending on the target of your group. So support groups can have different focus. Some of them are different. You know, they'll have different, some are for couples, some are for families, some are for just the patient or the caregiver. Some of them may have targeted focus. Maybe it's survivorship, or maybe it's while it's in treatment, or maybe it's for your particular type of cancer. But a lot of options are available usually for support groups. So make sure, even if when you're with your provider, that you talk about what's available. I know at Texas Oncology, we're always thinking about how do we provide another layer of support to make sure that we're seeing the whole dynamic and providing support across the continuum. And then support groups also provide that encouragement and motivation to manage conditions and even stick to treatment plans. Sometimes, you know, we hear all kinds of things about the fear, maybe changes and fatigue or different challenges with care. And sometimes having someone say, oh, wait, like I had this symptom and here's what I did, or yeah, that's normal. Maybe when we were maybe taking a turn within the care because we just didn't understand. So having someone to be able to encourage us or motivate us or hear their success story, or hearing stories like from people like Sydney who are on the other side of survivorship, where they're able to share what their experiences are like and to validate, can be really impactful. Gaining a sense of empowerment and control or hope. One of the things I love about support groups, particularly for patients that are in treatment, is that we help to educate and empower them to be part of the care team. And so sometimes we feel like consumers, where we're taking it in, we walk into the doctor's office, they're telling us what they're going to do, but maybe having someone to help and encourage us and motivate us, to empower us to say, what on our terms, here's what I'd like to see, what about this, and take our questions and those kind of things we gain from support groups, from hearing other experiences and approaches and ways we can do that. It also can help improve our understanding of our disease and our experience. Like I said, I can't say enough about the validation and support that comes just from the community. Also, disease education. Depending on the type of support group you're in, there may be opportunities to learn more about your disease, what is normal course of care, or even education about additional treatments that maybe you haven't heard or had access to. So there's so much information. There is peer support groups where that means you're with your peers. And then that's really facilitated maybe by someone, but really the conversation is between you and a peer. And then there is therapeutic facilitated support groups where there is a clinician, like a licensed clinical social worker or a counselor or someone that's going to facilitate the support group, but it's still in collaboration with your peers. And then there are education support groups where the focus is really on giving some content. For example, a doctor may come in and provide information and education, or maybe a dietitian or someone is really trying to relay and impart information to make sure you can get it. So there are a lot of different kinds, a lot of different types. Sometimes they meet on Zoom. Some organizations have their own virtual platforms where you may meet and maybe go through your portal or different things. So there are a lot of different options, but I would really encourage you to look at support groups as an option for your cancer care.
Yeah, and doing them virtually, right? Thank you, pandemic, little silver lining, is so great because you don't have to, get out of bed. Like some days we're just not up for that, for starters. And then you don't have to drive somewhere and you can connect with a broader group of people. And maybe you're looking for a support group for people with just your disease that are around your age, right? And that might be available. Whereas if it was in person, that might not be available in your community, right? So,
and I think even when we have patients sometimes who maybe aren't feeling well, but they still want to participate, and we'll be like, listen, turn your camera off and listen if you have to, or take it from bed. We don't care. And so I think it gives you that flexibility to really engage, even if you don't feel up to it.
Right. And I'm guessing the folks that are on this webinar are exactly the kind of people who would take advantage of a virtual support group, right? You know the power of connecting, and we're glad you're here. And from my lens as a fellow cancer patient, I know how isolating it can be. I mean, I was really fortunate to have a lot of community and family step up alongside me, but none of them were also in treatment, right? They were supporting, which was huge, but being able to connect with people who understand what it feels like to be the patient is a whole different thing. So hope you take advantage of that.
Absolutely, absolutely.
Right. So we just kind of wanted to wrap up again. We've talked about a lot of different ways to use virtual care and types of virtual care, but when do you use it? How do you use it? Just wanted to reinforce that. So you certainly want to talk to your care teams about what virtual care options and opportunities are available. Ask for it. If that sounds good to you, say, hey, can we do this next appointment virtually? Like, do I have to come in? That's totally fair. Ask for it. Or do you have electronic patient-reported outcomes? I'd like to do that. Or do you have remote patient monitoring? I'd like to do that. Or maybe you're not signed up for the portal. How do I sign up? Advocate for yourself, because this is available at a lot of cancer centers and providers, and it should be a tool that's available to you. So ask for that. It's a fantastic tool for when a family member needs to join your visit. So maybe your, son is your primary caregiver, or maybe like in your case, it was my mom was my primary caregiver, even though I was an adult. And there's an ability for your caregivers to join the visit at the time of the visit and hear what you're hearing and be part of the care, which is really fantastic. And they don't have to go anywhere to be able to do that. It's great to use when you don't have transportation, or even when you have transportation, but you just don't want to use it, or, maybe aren't up for it that day. It's a really good tool. For me, I'm still a patient and I love to use virtual care because it's less time off of work. I can, be at my computer and just pop in for my visit and then pop back out and finish what I'm working on. So that's a really fantastic tool. I will warn you now, most providers still often run late for those virtual visits. So give yourself a little buffer of time. If it's scheduled for 9:15 a.m., still give yourself till 10 o'clock or whatever. Even though you don't have to drive, they may still be running late. So do be prepared for that. And then, virtual care does let you connect to more members of your care team and maybe to access care team members that aren't available in person in your community. So I touched on the physical therapy. I know that there's physical therapy groups that do virtual work. If that's not convenient or just not available where you live, then look into that. Same with counseling. Stephanie, you touched on that, but do you want to talk a little bit more about that?
Yeah, I think, for some people, they're the counselors who maybe, if you may not have access to a counselor or a therapist that has experience with oncology, and you want someone that has that awareness. And so this is a great way to maybe connect. Maybe you're in your practice, maybe that's not available, or wherever you're receiving your cancer care, they may not have that component. And you have the ability to really engage with someone that specializes in the care that you need. And even, I think, supplemental services and additional specialties, even like, for example, palliative care. One of the things that we do also is try to make sure that that's available virtually if there's access gaps. And so I think that's something that can be really, really impactful, or even specialty visits. For example, when we're having goals of care conversations or advanced care planning, when you maybe want the person that you're going to ask to be maybe your healthcare agent or medical power of attorney to be involved so they can get some be really informed. Maybe they're not local, right? And so we have the ability to be able to connect them into that appointment. And so that can be really impactful as well.
I know we also use it to offer genetics counseling, right? Maybe for you or a family member, if you're worried about something running in the family, that's a great way. So a lot of great opportunities there. Or maybe you're bilingual and you would prefer a provider that speaks your native language. And so sometimes that's a way to be able to connect with somebody who speaks your language. So a lot of opportunities there. It just kind of broadens your net. Now, the one thing that you do want to be careful with is that even though it feels like you've got this whole world of medicine at your fingertips, you should be in the same state as your provider. They have to be licensed in the state where you are. So one thing that's not good is like, if you think, oh, I'm going to be on vacation in Florida, but you're not from Florida. I'm going to be on vacation in Florida next week, but that's okay. I can just do my telemedicine visit there and stay on track. Providers can't really do that. They have to be licensed in the state where you are physically present. And I know that seems just really weird and counterintuitive, but is the current state of the laws out there. So you do need to be in the same state as your provider, or they need to be licensed where you are. And some of these bigger virtual care companies, particularly, they work all that out in the background. But just you as a patient, please don't plan to be on vacation in a state and think that you can still see your home provider. Not cool. We don't want to do that. Not good. And then, just use virtual care to be empowered in your care, whether that's through using the portal to look up your own results or your next appointment, or using those electronic patient-reported outcomes to really tune in to how you're feeling when and what you need, or the telemedicine and telehealth to, make it easier to access to your care team. This is a tool for you to use to make your journey easier. It's not meant to replace all in-person care. It's not the only thing, but it's a really great part of care that we have available now. So I hope it's something that you'll try if you haven't.
Absolutely. And that's just one thing I will say, as great as it is, also we just encourage you guys to always be safe. Make sure that they're connected to your provider. Are you verified, that they are who they say they are, especially if you're going to seek out like a supplemental service or that kind of thing. So just make sure you validate their credentials and that kind of thing if you're going to jump into something virtual. But also, there are a lot of safety precautions that are in place to make sure you can be safe. So I don't want you to be afraid to do so. But just make sure that whoever you're talking to, if they're supposed to be a licensed professional, that they actually are.
Absolutely. I think that's all we had planned to cover. I don't know if there's any questions
Let's see if we got any questions. We don't have any here, but I'm going to ask you a question, Sydney.
Okay.
I know you said ask for virtual care opportunities. What do I do if I'm not sure my practice has any? Could you give us kind of an example of how I have that conversation with my doctor?
Yeah, I think, next time you see your doctor in person, you could say, hey, do you do telemedicine? Is that something that I could do with you for my next visit? Is that appropriate for next time or for another time? Like if I'm urgently not feeling good, like when do you do telemedicine? And is that something we can talk about? So just bringing that up. The portal, Absolutely. If they have not already asked you to join the portal, they should, or maybe they did and you weren't interested at the time, but just ask again. Hey, I don't think I ever signed up for the portal. I'd like to be able to do that. And, how do I do that? And then you could also ask, how responsive are you? Is it good for me to send you a message? Is that a good way to communicate with you? Or would you prefer that I call? And that's important to know. If they're like, oh yeah, well, we just never get to those messages. That's probably not what you want to do. Or they might say, absolutely, that is the best way to communicate with me. I look at those all day, every day. Please use the portal. So, asking not just how do I access it, but how should I use it? How do you like me to communicate with you is always good to know. And then same for those patient-reported outcomes. Not everyone's going to have them, but some will. You could say, hey, I went to this webinar about virtual care. I saw something about, if you don't remember electronic patient-reported outcomes, like you could say surveys or surveys on how I'm feeling. Do you have a tool like that? I'd really like to be able to check in with you and to know more about how I'm doing and be able to have that. So those are things that I would ask.
Now I'm going to play interviewer. So are there any circumstances where you think maybe virtual care isn't a good option? Is there maybe a patient population or someone who you're like, yeah, virtual care is great, but maybe not the best option?
Yeah, well, we talked about connectivity issues, right? So if you live somewhere where you don't have good internet or cell service, which can be in the middle of a city, right? There's just like those black holes where there's not good connectivity, or it could be because you're rural and there's not good internet there. Like it could just be for any number of reasons. So if you live somewhere that you don't have good connectivity and you don't have another private place that you can go, it's probably not great. However, some places will still say, yeah, you know what? We have a virtual dietitian. We'd love for you to see them. I understand that it doesn't work for you at your home. Why don't you come on into our clinic and we'll set you up in a consult room or an exam room and you can see our virtual dietitian from the clinic. And that's also a great opportunity. And that's helpful if you maybe aren't as comfortable with technology, you don't feel like you could get on at home. Even if you have the connectivity, you could ask if that's an option. Do you have any special services, supplemental services I can access from here?
Yeah. And I think that's a really great point, that sometimes we're able to make those pivots, and you have to just talk to your provider about what pivots are available if you don't have access and have connectivity issues. I think also it's important to be mindful of the patient, their ability to engage virtually. And so if you're, for example, a caregiver and maybe you're comfortable, making sure that they would be comfortable, but any communication or barriers that would maybe exist in person would also exist virtually. So you may just have to be mindful of those.
And the patient does need to be on. We have had occasions where the caregiver is like, well, I'm here. I'm the caregiver. I'm here.
I'll tell you how they feel.
Yeah, the patient does need to be on. So make sure that you are present at your own visits for sure. But yeah, so I think the biggest kind of don't use it scenario to me is if you don't have that connectivity. And then the other thing is if you feel like there's something that really needs a hand-on exam. I'll tell you, I was like the queen of pneumonia for a lot of my treatment. I had pneumonia often. And I knew that I wanted, even though I love virtual care and would have really liked to not go to the office, I knew that I needed them to listen to my lungs to know what's going on. So if there's something that you feel like you just really is going to have to be done in person anyway, then you might decide to go ahead. And some things, you'd be surprised how much we can do virtually, and you can always try it. And if it's not working, then they should just tell you, this is something I need to see you in the office for, and then they bring you in anyway. But those are, if there's something that you just feel like is so important for hands-on, or you've got like a wound that you think they need to see or touch or clean, right? Obviously that stuff is a little bit harder virtually. Well, I hope that this was helpful for folks. We are available for follow-up. If there's any questions that come in, I'm sure that Natalie can get them to us and we can respond.
Well, I want to thank both you and Stephanie for presenting on this. It's a good topic for us. Our foundation hasn't covered it, and it was a lot of information. It's a lot to digest. So if there are follow-up questions, definitely reach out to the foundation. I know Sydney and Stephanie would love to answer them. So also I'll mention that this webinar will be archived. So you can, if you need to watch it again and take notes, you can find that on our website probably by early next week. And, with that, I'm going to let everybody go, but thank you again, Stephanie and Sydney, and everyone. Have a great week.